do that?
I got you.
Yeah.
Thank you for joining us for our presentation today. We are Group 10. I am Samantha Penny.
My name is Julie Pham. I'm Brenda Arroyo.
I am Jasmine Kaur.
And I'm Crystal Hahn. And our proposal is about pollution in low-income cities in California. So summary, our proposal is to reduce the health disparities among populations that reside in low-income cities in California. Our goal is to help those who are affected by air pollution in these areas. The following presentation will include background, which pertain to history, statistical facts, and basic context and terminologies on polluted low-income populations in California. Our program proposal includes the importance of our focus on low-income cities and how air pollution may be an important factor in their health outcomes. What the application of our proposal may look like are staffing, cost needs, and operation layouts, and which also include our observations and closing.
Some background on this issue. In 1943 is when people in California first started recognizing that the smog was starting to irritate their eyes, it was burning their lungs, and they were having nausea. Some facts: California has 8 out of the 10 most polluted cities in the US, and 28 million Californians live in counties where ozone or particle pollution levels can make the air unhealthy to breathe. The concept of our proposal is to supply people in low-income neighborhoods with good quality air masks to help produce or prevent any future health conditions. Some terminology you will hear throughout our presentation is air pollution, which is defined as harmful substances such as gases, particles, and biological molecules that are introduced into Earth's atmosphere. And you will also hear low income, and we will be focusing on San Francisco, Los Angeles, and Fresno. And low income considered in those parts of the city are anyone living under $117,000 in San Francisco, $47,850 in Los Angeles, and Fresno is $12,150. Our program proposal is to reduce health outcomes to provide filtration masks to low-income cities with highly polluted areas. To further this impact on these low-income areas, we hope to provide resources and educate the following populations in these areas. Our filtration masks we are focusing on are the N95 and the P95 respirator masks. And then we will also be educating and providing resources to those populations, such as going to events at community centers and focusing on outreach at schools, government-run operations, and nonprofit organizations.
The N95 filtration mask is specifically designed to provide respiratory protection by forming a tight seal against the wearer's skin and effectively filtering out airborne particles, including pathogens. The N95 mask will filter out at least 95% of airborne particles. And on the screen right there, we see an example of a respiratory mask and how it should be properly used on the face.
As part of our program proposal, we will educate communities through the exposure risks of respiratory hazards. We will create events for the community that are impacted by air pollution. We believe that to change and better communities impacted, we need to educate them about the dangers of their environment. By providing them with these resources, we can help these populations be more cautious about the dangers of bad air quality, the changes they can make, promote safer living styles, and help influence local politicians and involving local companies who regulate emissions for the change for better air. We will introduce the exposure risks on how N95 filtration mask is better use of protecting against air pollution than regular surgical masks. as indicated on the diagram, there shows like the protection against pathogens in the air. The source of air pollution, which include highways and emission from cars, oil refineries, Superfund, and toxic waste sites. Another part of educating communities is the proper use of masks, as indicated on the diagram in the slide. This ensures that citizens are protected by proper use of masks. We will also demonstrate how it is properly used. Unlike regular surgical masks, N95 filtration masks can be used correctly to be able to protect out pathogens.
Okay, so now we would like to educate the community about the health outcomes from exposure. So long-term exposure of pollution can include lung damage, loss of capacity, and lung function. And those who are exposed may develop asthma, bronchitis, and cancer. And we would like to highlight that many of the health outcomes are internally impacted. So this means that it is not easily diagnosed without a physician's examinations. So as for staffing and operations, for recruitment, we would like to recruit volunteers, and they can be easily recruited through local and nonprofit organizations. And we would like to partner with local groups or programs that have similar goals and ideas to our proposal. And for supervision, we would like to have a team that includes a project manager, a treasurer, a marketing team, event organizers, a secretary, and a community outreach team. And some of the tasks includes distributing masks to those who are affected by the heavy pollution, to spread awareness of how the air quality directly affects the health, and to facilitate and lead the project.
As for financing, both the N95 mask and the P95 mask are quite affordable. The N95 mask is about $7 and the P95 mask is about $15. And the funding for the mask will be obtained through donations, community fundraisers, and grants from the cities with the air pollution issues. Also, both masks are essential because the N95 mask protects from particles that are found in the air that comes from car emissions, and the P95 mask protects from oil-based particles.
As for our value, our innovation proposal is important because everyone, whether your economic status is low or high, deserves to breathe pure air regardless of your status. And making a change to this ongoing issue within low-income areas can help prevent chronic issues such as respiratory illness, cardiovascular conditions, and even nervous system damage. Many of the chronic illnesses that are associated with breathing polluted air can be prevented by taking the measures presented in our innovation proposals, such as the mask. In conclusion, both our physical and sociology well-being is affected dramatically when breathing in pollution. By utilizing these face masks, we can eliminate the amount of polluted air in low-income communities. This raises questions for environmental justice for communities living in these low-income cities and the risk factors they are exposed to. By providing resources and educating the community on N95 filtration masks, we can eliminate the amount of pollution society breathes in. Thank you for listening to our presentation.
I'm gonna stop it.